So I got this interesting question from a patient in regards to optimizing recovery and body composition, specifically the simultaneous goal of fat loss and muscle gain. So I wanted to take a moment to answer this question because I think that it's one that multiple people have, and it's not a straightforward answer. So the specific question was, I'm looking to build muscle and lose fat. Do you have any dietary suggestions? I feel hungry after workouts, but am aiming to achieve fat loss as well. Is this feasible? So, several questions in one, but all related to the goal of not only improving, essentially enhancing body composition. And yes, it is feasible. It can be a little bit challenging. Oftentimes, it's best done where someone is doing a bulking phase and or a cutting phase and doing them simultaneously repeatedly over multiple microcycles in order to achieve the optimal body composition that they're looking for. So if we were going to break this down into a stepwise process of how do we go about this? So first you have to measure what you're trying to change. So a scale is grossly uh, inappropriate for really measuring body composition. So we can't go off the bathroom scale. We need to actually measure what we're trying to measure, and that is fat loss and or body composition. In order to do this, I would strongly encourage using a gold standard. That is potentially there's several companies that offer these. So these are either going to be in the form of a DEXA scan or a bod pod, and this can be done through a couple of different companies, DexaFit, BodySpec, or you can go on the website Fitness City, and they will also have several partners online that would or throughout the country, but you can find them online as far as the different scans that they will do. They also offer bod pod scan, which is a different form of body composition, but has shown to be comparable in regards to DEXA when it comes to body composition, fat-free mass, as well as body fat percentage. Step two, once we've established where we are actually at and from what we're trying to change, we need to determine our basal metabolic rate, or how much we actually burn at at rest, essentially. And again, you can do this based off the DexaFit, the Body Spec, or the Fitness City. They all uh, give you options to look at what is your resting metabolic rate, and they'll calculate your how many calories your body will burn, or in a predictive using a predictive equation over a 24-hour period. You will then obviously need to have additional variables put into the equation to determine like what is your caloric intake that you need on a given day based off your physical activity level, uh, what your goals are in regards to increasing muscle mass, for instance, or recovering from injury. You can also use a predictive calculation, and I've hyperlinked one here on this Word document. We can do so online. Additionally, from the Journal of Athletic Training, what they recommend in their positional statement that was published in 2020 is using this predictive equation of daily energy expenditure. That is how many calories you're burning per day would be your resting metabolic rate, which you could then get from one of those three companies listed above, multiplied by your activity level, multiplied by your stress factor. And this is like essentially your physical stress factor or recovery factor, and we'll talk more about that. So if we broke down each one of these variables, your resting metabolic rate can be indirectly measured through the calorimeter. It could be done through your wearable predictive devices. However, they significantly underestimate your calories, anywhere between 300 and 1,000 calories, depending on the brand. You could use, again, one of the resting metabolic rate services listed above that would provide you a relatively good estimate of what your RMR is. You can also calculate this based off your gender using the equation here. And then if you had gone to get a body spec done and you had your fat-free mass, then you can get an even more accurate measure by multiplying that by 21.6 and then adding 370 to that. You're then going to multiply that by your activity level, and your activity level would be sedentary, light activity, moderate, very active, or extra active. And what that would look like would be you would be multiplying it by a factor of 1.2, 1.3, all the way up to 1.9, depending on how active you are. Your stress factor is based off what you're trying to recuperate from. So a minor injury, you would multiply that by 1.2. And that is appropriate for this patient in question. And so if we calculate this for this individual, we'd be expecting, again, a 25-year-old female, 50 kilograms, approximately 170 centimeters. This would come out to about just over 1,300 calories per day. So step one, measure what your body composition is and what you're trying to change. Determine what your basal metabolic rate is, or your resting metabolic rate, and you can do so through this calculation. Step three is daily energy intake. So now we know how much you're predictably burning. We need to know what you're actually taking in. This takes some exploration. I would strongly encourage using a nutritional log for at least 3, maybe even 5 consecutive days. You can do this very easily using MyFitnessPal app or Chronometer. I like Chronometer specifically because it allows for macronutrient calculations as well. And then they will also give you not just how many calories you're taking in, but also your macronutrient composition. That is how much carbohydrates, how much fat, and how many grams of protein you're taking in on a daily basis. So this step 3 is simply observation of like what is currently existing in and how that compares or contrasts between what you're actually burning and what your body needs. Next is modifying the current daily nutrition in your intake based upon the calculated or the predictive 1,300 kcals listed above. So moderate to current daily nutrition. So we need to modify your macronutrients, which is your carbohydrates, your protein, and your fat. Now there are some evidence-based guidelines that help determine what is the best kind of breakdown from a macronutrient standpoint in regards to building muscle, which is our primary goal. And really the cornerstone of our macronutrients are going to be our protein. So recommendations for protein is on the higher side if we're trying to gain muscle mass, particularly if we're trying to maximize our body composition, and that would be 1.4 to 2.2 grams per kilogram per day, with the understanding that for every gram, that equals 4 kcals or calories. And so for this individual, it would be, if we're using that same 25-year-old female, it would be anywhere between 72 and 112 grams of protein per day. That would equate to 280 or 448 kcals in a given day. And then next is our fat content. We would want that to be either 15 to 30% of our total caloric intake. Being anywhere between 20 and 30% ensures that we can actually absorb the fat soluble vitamins from our diet. So it's not really recommended to go to on the lower end of that, especially if we're trying to maximize body composition. And so first establishing protein needs and demands, then calculating what your fat content or intake would be, which is anywhere between 200 calories and 400 calories from fat, which would be 22 to 44 grams of healthy fat, less than 10% of this being saturated fat. If we were trying to really optimize protein, we could go as high as 3 grams of kilogram per day, which would be 150 grams or 600 kcals. We'll go with the upper bound of the 2.2, but again, you could bump this even higher. 112 grams of protein, 33 grams of fat, And then if we calculate the remaining calories, this would be 147 grams per day. This step 5 is considered to be optional, because now that we know what we need to, like our macronutrient breakdown, it can be a little bit of a daunting task if we're not familiar with nutritional science or nutritional biochemistry, as far as like how we actually consume this over a day. And so I also strongly recommend consulting a registered dietitian or certified sports nutritionist to help guide you along this process. These services are often offered through your medical health insurance. All you need would be a referral from your primary care, and oftentimes, given the fact that lifestyle medicine is the best preventative medicine for fending off non-communicable chronic diseases, as well as maximizing one's health span and lifespan, that oftentimes primary care physicians are more than happy to suffice in sending a referral to a registered dietitian and certified sports nutritionist. The second, you may have to vet and find these individuals. The standard referral may not get you to someone who is familiar with your specific goals. But any registered dietitian or nutritionist would help guide you in this process, especially if you are very specific about your goals. All right, next you want to monitor your body weight. So again, I mentioned early on that this is kind of a gross underestimate tool of really what we're trying to change. But if we have a decent idea as to where you're starting from a body composition standpoint, and we're very strategic about your macronutrient intake, then we can rest assured that the majority of the weight that you are going to gain is going to be predominantly lean muscle mass. There may be some fat mass that's associated with this, as any increase in body weight otherwise would be. But again, this is going to be depending on this in combination with your training session, your training regimen, which we'll talk about, will help to mitigate the increase in body fat composition here. And this can also be done, it can also be lost through a subsequent weaning program once you've built the muscle mass and recovered from your physical injury. So you're going to monitor your body weight. You're going to take your weight daily, same time, same place, same scale, and you're going to track it over 4 weeks. And you're going to calculate the weekly average, because it's going to fluctuate from day to day, and even from from day 1 to day 7, you may notice a change. However, this is likely just fluctuations in water weight. It's not a true representation of what the regimen of how the regimen is working. That's why you need to track it over a minimum of 4 weeks. Based upon that, now that you've established, okay, this is what I'm consuming. Is there any change? How accurate are our calculations? Am I staying the same? If not, then we need to introduce a caloric surplus of anywhere between 300 and 500 kcals per day, using the same distribution of macronutrients. And then we're going to continue to track the body weight daily, and we're going to calculate the average daily body weight as well. And what we would shoot for is that when we look across the trend, when we plot our average daily weight over 12 weeks, that is 3 months, it does take time, particularly if we're trying to be strategic in our weight gain, being lean muscle mass, is that this just takes time. And so we need to be slow and steady and methodical in our process if we're going to be successful. So if you were to plot your weekly average body weight over 12 weeks or 3 months, then the expected increase would be 0.5 to 1.0 pounds per week. And then the daily meal and protein timing, examples of how you may want to distribute this nutritional intake and bolus in or around your rehab and or your exercise training would look something like this. We know that we need equal distribution of protein across a given day, particularly 20 to 30 grams. Again, you could, if we're being specific to this individual, right, she's not really consuming 180 grams per se. So you would diminish these grams accordingly in order to total her 112 grams or even if she's going to go a little bit higher, 130 grams of protein per day. Directly around your training session, you do have some options beyond just supplementation with macronutrients. For instance, there has been good success shown when supplementing with creatine monohydrate. Though these are not necessities, using a lean, high quality protein that has high concentrations of the amino acid leucine, such as whey or essential amino acids, are potentially recommended. HMB is a supplement that is a metabolite of leucine and has also shown to enhance lean body muscle mass composition, not only in immobilized and injured populations, but also in those that are training on a regular basis. And then there's also the benefit for post exercise nutrition within anywhere between 30 and 30 minutes and up to, it's been touted, as much as 3 hours, but the sooner often the better when trying to maximize body composition. Okay, so a decent amount of information to take in. I understand this. I will also provide this Word document as a reference so you can go back and review it. Okay, let's talk about the training recommendations. So there's going to be two primary components. There's going to be cardiovascular conditioning so we can optimize our body composition, and there's going to be resistance training. The resistance training we'll review on the next page, but cardiovascular conditioning. So we're going to have 1 to 2 boluses of high intensity cardio training per week. So your standard workout would be 5 to 10 minute warm up and a 5 to 10 minute cool down, and in the middle you'd be doing 4 minutes of all-out efforts followed by 4 minutes of all-out rests, and you would be repeating this 4 times. So in totality, it would be 32 minutes of the workout. If you add in the warm-up in there, it will be just shy of an hour, close to 45 minutes, depending. The form of cardio that you're doing is to your discretion. If we're recuperating from injury, we may need to use multiple modes of cardiovascular training, such as like maybe it's a rowing erg, maybe it's a stationary cycle, maybe it's an elliptical, maybe it's an aerodyne bike, one of those big fan bikes where you're moving your arms. Any one of these, even if you were to cycle through them so you're not putting too much concentrated tissue stress on the injured area over the course of your workout, such that it's still within the tissue capacity, yet you can still get the high intensity benefits, would be recommended. But the form of training is really based upon your desire, as long as you're getting your heart rate up close to 90 to 100% effort for those 4 minutes. Zone 2 training. Zone 2 training is your lighter form of exercise. It is the one that you could potentially hold a conversation, but it's kind of uncomfortable to do so. And the person that you're speaking to knows you're exercising. You're kind of huffing and puffing, but it's really not this all-out effort. And this is strategically what is called a physiological zone 2, meaning we would actually be wanting to track your blood lactate. We won't get into the minutia of this. Sometimes less is more, but essentially you're trying to achieve anywhere between 1.7 and just under 2.0 millimoles of lactate throughout the duration of your cardio training. And the significance of this is where fat is burned the most, and where your mitochondria, which are the small organelles within every one of your cells, particularly within your muscle cells, are optimized to be most efficient through continual training. And you would need 300 minutes per week, a minimum of this. It should make up 80% of your cardiovascular training. It should be 45 to 60 minutes per session, minimum of 45 up to 90. But again, if we're going to be strategic with our time and we're going to want to maximize the frequency at which we're doing this across a week, then it would be 3 to 4 times per week. And thus, we would not necessarily need to go up to the 90 minutes unless we had the ambition and desire to do so. So zone 2 is where you're going to be burning your fat. Um, the high intensity cardiovascular training allows for good endorphin release, and this is significant in the sense that it also can help to bolster some of the other physiological effects, as well as the hormonal effects and endorphins that are released with exercise. Resistance training, strength training is also critical and maybe the most important when we're trying to achieve this goal of high lean body mass composition, as well as while simultaneously reducing our body fat composition. All right, so our loads, we know, I'm not going to go through the details here, but uh, we need our loads to be heavy. They need to be over 70% of our maximal effort. So if I could squat 100 pounds, I need to be at least squatting 70 pounds. Our volume, we need to be doing 10 sets per major muscle group per week. We need it prudent to it may be prudent to limit incremental increases in the number of sets for a given muscle group to 20% of previous volume during a given training cycle, that is 4 weeks, and then readjusting accordingly. The volume per exercise is usually between 4 to 5 sets of 10 to 15 repetitions, trying to take each set as close to failure as we can. The frequency is that we need to be training at least 1 to 3 times per week, depending on our training status. Those that are more trained need to be training at a higher frequency. I usually recommend twice per week, a minimum for the major muscle groups. And then you could distribute that how you like into upper body or lower body. If you're training 3 days a week, well, then you would obviously potentially have either a full body day where you're emphasizing upper body or lower body, and or you could even alternate it upper body, upper body, and then the following week you would be doing this the alternative where it would be upper body, lower body, upper body, however you want to break it down. Relatively short rest periods keeps a high metabolic demand. Also, supersetting your exercises. That means not just doing one exercise at a time, but you're doing almost a small circuit, one exercise, set one of exercise number two, and bouncing back and forth between the two will help with the shorter rest periods. It's more metabolically dense and often shows to have superior outcomes when it comes to hypertrophy and muscle strength gains, depending on which specific exercises you're partnering with one another. We want to choose large complex movements. This not only is beneficial for hormonal responses that will help to build our muscle mass, but it is also, again, more metabolically demanding. Thus, we will likely optimize our body composition. Set endpoints for novice lifters. These can achieve robust gains in muscle mass without training close to failure or up until that point. The more trained that you are and the more trained that you become, the closer and closer that you need to be able to train close to that failure point. Particularly in those individuals that have difficulty achieving an anabolic state, such as older athletes or older individuals, they should employ failure training more sparingly to allow for adequate recovery. But this being said, it is safe and effective, particularly when the individual has been given proper instruction. So there's multiple variables that we need to be considering when trying to answer these important questions that this patient posed. It's not necessarily straightforward, but there is a methodical and strategic stepwise process in order to be able to achieve her goals. I will also leave you with some additional recommendations on resources that I have also found influential when trying to tease out some nutritional guidance. So specifically, these 3 individuals have been influential in my understanding of nutrition. So Dr. David Perlmutter and his Grain Brain, as well as the Grain Brain Whole Life Plan, Genius Foods by Max Lugavere, and the Longevity Diet by Dr. Walter Longo. More recently, I've also found benefit from Dave Asprey's work of Superhuman, as well as his Bulletproof Diet. And pretty much the most influential book has been that of How Not to Die from Dr. Michael Greger. So you can't rely solely on one source when you're trying to identify good, sound nutritional guidance. It needs to be individualized to each person. This being said, I do believe that the guidance that I've provided here is sufficient to at least get you on the path to being able to achieve the goal of maximizing body composition, that is, increasing muscle mass, simultaneously losing body fat. Thanks for listening.